Good day, folks. Alfie Vente here once again at Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a terrific day. Welcome once again to our soft tissue case study. This one's entitled The Hockey Hippy Part 1. So I want to thank you if you watched our previous case studies. Again, these case studies are based on cases that I've seen, treatments that I've done over the years. A number of them are a combination, actually most of them are a combination of different cases that I've seen. And I wanted to share what I've learned with you guys. So again, this is not just strictly for massage therapists. It's for those of you guys that have training in working with the soft tissues, fascia, and muscles. So that you could be a physiotherapist, you could be a physical therapist, you can be a chiropractor, you can be an athletic therapist. Anybody that has training in soft tissue techniques, you can actually apply these case studies. So now let's get on to this case study. Your patient client is a 40-year-old male. The patient works as an accountant and sits between 6 to 8 hours a day. Sometimes he brings home his work and may continue for another 3 to 4 hours at home. He formerly was a college-level hockey player, but hasn't consistently played for at least 10 years. His friends have invited him to play in a recreation league twice a week. He has accepted. And remember, this first part, I have a number of questions for you at the end of this case study so that you have a chance for maybe about a week or so to study this case and formulate some answers for yourself. He has been playing for 3 weeks now. At the moment, he is noticing pain, tightness, and discomfort in a number of areas that seems to be getting worse. He wants you to fix him. He has not encountered any trauma to the areas of primary and secondary complaints and tertiary, and basically all the other complaints that he has with his presentation. So that's your case study. On the health history, actually going further with the case study, on the health history and from your questioning, this is what you have surmised. That primary complaint is of pain and discomfort in the superior anterolateral aspect of the right thigh. He is noticing pain towards the lateral aspect of his knee. He also mentions that he feels pain located around his right sitting bone, his ischial tuberosity, so he mentions that to you. There's also tightness of the gluteal muscles. So this is based on your palpation. It seems, and also from this patient client's feedback to you, that he feels that the hip, the glutes are very, very tight. It seems that the symptoms are constant, but he really feels it spike during his hockey games. So, it's constantly there, but like as he plays, he starts noticing the discomfort. He rarely stretches and is inconsistent in regards to exercising. So we're going to go on to the key observations, but before I go on to the key observations, if you like our content, please like, share, subscribe. Pass this on to those that you feel this might be helpful for. I also invite instructors, if you feel this might be helpful for your students, to pass this on. We really invite you to do that. We really appreciate it too. If you're on YouTube, please hit that notification bell also. As I said, we're going to have these case studies hopefully weekly so that you can study them and potentially participate. So the key observations. Palpation superior to the area, just inferior and lateral to the anterior superior iliac spine of primary complaint produces a bruising sensation to the area of complaint on the right side. So, as mentioned before with the case study, this person's feeling pain around the anterolateral superior aspect of the right thigh. So this is when you're palpating, there is that it produces a bruising sensation in the area that this person has talked about. Drastically more tightness of the right gluteals, hip, and tensor fasciae lata versus the left on palpation. Deep pinpointed palpation of the erectors of the thoracic erectors of the right side exhibit a referral into the right ischial tuberosity. So when you're digging into the thoracic portion of the erectors, there's a referral that seems to be going to the ischial tuberosity. Going on with the more key observations. Palpation of the lateral aspect of the right thigh showed tightness and tenderness. So up and down the right thigh, you notice that there's a lot of tightness and tenderness. This is relative to the left side. When performing obers and modified obers, this modified obers is basically the knees bent. It is observed that the thigh and leg remain elevated at a 45-degree angle. That's a positive sign. So in other words, it doesn't go past the leg that is on the table. It doesn't pass the table, so it kind of stays up. Performing Thomas test, you notice that that hip is flexed and that the thigh fails to touch the table. That's a positive sign also. And also, this is significant, also you notice that the thigh passively abducts. So when you do the test, you notice that the thigh not only stays up, excuse me, stay up, but the thigh also passively abducts. Femoral nerve test is negative. So now you got the case study and the key observations. These are the critical thinking questions. If you've got a pen and paper, if you got your laptop, write these down and consider your answers over the week or so. Number one, what is the main structure that's potentially causing the primary complaint? Number two, what is your explanation of why your patient is encountering knee pain also? Describe the pathogenesis. 3. Explain the overall cause of your patient's presentation. And finally, what other strength, length, and special tests might you consider for this particular case? So those are your 4 questions. Remember, we have a follow-up video so that we discuss the answers to these potential questions. So in the following week, pay attention to LinkedIn and YouTube. We do have the answers and discussion part 2 of this case study. We'll discuss this case a little further. Thank you for watching. We really appreciate it. Again, please follow us on our social media. Please like, share, subscribe, and pass this on to those that you feel this might be helpful for. We want to thank you in advance, and also hit that notification bell. And by the way, you can visit our website, our clinical website, ventepainrelief.com, and also our pain relief fitness website, vprc.ca. My name again is Alfie Vente of Vente Pain Relief Clinic at vprc.ca. We'll see you in the next video. Have yourself a terrific day. Take care.